Pennsylvania caused by this virus since we first detected it here just 2 weeks ago. As of 12 a.m. this morning, we have 103 new cases of COVID-19. This brings our statewide total to 371 Pennsylvanians who have tested positive now in 28 counties. Yesterday, we had 83 new cases in one day, and today we have 103 new cases in one day. Approximately 40 Pennsylvanians have required hospitalization since March 6th, when we confirmed our first cases. This is approximately 10%. 3,766 Pennsylvanians have tested negative to COVID-19 to date. Each day, we tell you how important it is to stay calm, to stay home, and to stay safe. This is more than just a catchy phrase. This virus is deadly, and we need to practice social distancing to minimize its spread and its impact. I know that this is a stressful time for everyone, but I also know that Pennsylvanians are strong and resilient, and that our community will get through this if we all pull together. Here are my daily reminders. Wash your hands with soap and water for at least 20 seconds, which is the time that it takes to sing happy birthday twice. Or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Try to avoid touching your face, especially after touching surfaces, and clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of the virus, COVID-19. If you have questions about your health, please contact your healthcare provider. If you or someone you know is experiencing a mental health crisis, contact the crisis line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians is to stay calm, stay home, and stay safe. And now I can answer questions.
Thank you, Dr. Levine. Hadass Kuznets from KYW News Radio. Do you have any sort of timeline as far as how long it will take to flatten the curve in Pennsylvania, and how much longer people should abide by the coronavirus restrictions? Could it be beyond 2 weeks?
Mm-hmm. So we're in new ground here. This is a novel coronavirus and a global pandemic. We are still seeing an exponential rise of new cases in Pennsylvania and in the United States. So we don't have that specific information. I know that under Governor Wolf's leadership, our administration, the Department of Health, PEMA, working with all of our stakeholders and partners locally, statewide, and federally, are analyzing all of those questions as we speak. And as soon as we have more details about all of those issues in terms of the schools, in terms of businesses, then we'll be letting you know. But those questions are being discussed every day.
Dr. Levine, we have a lot of media outlets asking about the early symptoms. At what point should people go to the hospital, and how long do people tend to stay asymptomatic? Mm-hmm.
So the incubation period for COVID-19 is between 2 and 14 days. So symptoms would develop by 2 days or by 14 days. The average is approximately 5 days. First symptoms would usually involve a cough and then soon after a fever and leading to shortness of breath. But people have had other symptoms, particularly some gastrointestinal symptoms such as diarrhea has been reported. If you have some symptoms, maybe a very low-grade fever, but overall you're not feeling very ill, please feel free to call your healthcare provider. But the recommendation might be to stay home. We're seeing less flu now, and so we can presume that symptoms like that are probably COVID-19, and we'd like you to stay home and to take fluids and to take anti-fever medications and to stay as comfortable as possible. Practice social distancing at home. But you do not need to go to the emergency department or the hospital. But I would follow your healthcare provider's advice. If you are having a medical emergency, then, of course, call 911. But there is no treatment for COVID-19. There is no vaccine for COVID-19. So more and more, if you're having very mild symptoms, please stay home and rest.
Secretary Levine, we're getting a lot of questions about personal protective equipment and ventilators and whether or not our health system has enough.
So we are working with the hospitals and the health systems. I was on the phone today with the Commissioner of Health in Philadelphia and in Allegheny County. Our team also spoke with the Montgomery County Health Department. We're in contact with the Hospital Association about all of those issues. As we see more and more cases of COVID-19, I said approximately 10% of patients have symptoms that are significant enough to require hospitalization. It will tax the resources of medical centers, hospitals, and health systems. They have their own stores of personal protective equipment and other resources, but we have our own stores through the Department of Health and PEMA of personal protective equipment, ventilators, and other resources. And there are national stores. We also are looking at all options and very innovative options to try to get more, for instance, the N95 masks. So we're reaching out to businesses and corporations and manufacturing that might use N95 masks to see if we can access those stores. We're reaching out to other manufacturers, even in other countries, to see if we can get more stores of those masks. We have purchased ventilators from a manufacturer of ventilators in Pennsylvania, and so we will look at every opportunity to increase our supply that we will then pass on to hospitals and health systems to deal with the surge of patients.
From the morning call, Secretary, we are told that elderly and those with chronic conditions are more likely to need hospitalization for COVID-19. What chronic illnesses or underlying conditions are highly correlated with the need for intensive care?
So it is true that the elderly, that seniors, are more likely to have a severe case of COVID-19 requiring hospitalization and intensive care, particularly those with chronic medical problems such as heart disease, congestive heart failure, uncontrolled high blood pressure, those with diabetes, those with kidney disease, those with chronic breathing problems such as chronic obstructive pulmonary disease, those type of conditions. But I do want to emphasize, as we discussed yesterday, is that we are still seeing a significant number of young adults, so even in their 20s, 30s, and 40s, that have required hospitalization. So it is very important for younger adults not to be complacent. They need to practice social distancing, and again, please stay home.
And as a follow-up, a food service worker in Allentown nursing home has tested positive. Can you tell us how the state has responded to this so far as an intervention or increased scrutiny at the facility? So
I can't go into specifics about a single case in terms of patient confidentiality and privacy. But we are in constant contact with all nursing homes, including any nursing home in question. We have put out nursing home guidance in the last number of days to prevent cases and to deal with cases if they present. We are investigating this case and all other cases that have close contact with very sensitive populations, such as a nursing home, and we will do whatever is necessary to protect the residents and staff of nursing homes.
Secretary, Fox 43 would like to know how long does it take to get COVID-19 results? If it's 3 to 5 days, the numbers we're getting today would technically be from 3 to 5 days ago, correct?
Well, so there are a number of different ways to get tested for COVID-19 at this point, which is good because there's more ability then for people to get tested. We are still testing individuals at our laboratory in Exton, and we are testing and prioritizing specific groups of patients. For instance, people who might be in a sensitive area, like a nursing home or a healthcare provider and such, or if there's a potential cluster. So we're prioritizing those tests at the Department of Health laboratory, and depending on what time the test gets there, we can either have the test the same day or at the most the next morning. So at the most, probably less than 24 hours. In addition, hospitals and health systems have developed their own testing capacity, specifically the Children's Hospital of Philadelphia, the Hospital of the University of Pennsylvania, UPMC, Allegheny, and others. And so I don't know the exact turnaround time at those hospitals, but hopefully it's within 24 hours. We'll have to check on that. We do know that some of the commercial laboratories have a longer time until we get results, such as LabCorp and Quest, and it can be a number of days. So you're correct. Some of those test results I'm reporting today, the samples were obtained a number of days ago, specifically for those commercial laboratory specimens.
We have two follow-up questions on testing from Sarah Ann Hughes from Spotlight, PA. First, the Washington Post reports officials in some areas are urging people not to get tested in order to conserve limited PPE and testing supplies. What's PA's message regarding testing and the need to ration limited supplies?
Sure. So, as I was saying before, it might not be necessary. In fact, it is not necessary to test someone who has very, very mild symptoms, has no other predisposing chronic medical conditions, as I discussed, and is at home and relatively comfortable. Please stay home. You can contact your healthcare provider to discuss the situation. Take anti-fever medications such as acetaminophen or ibuprofen. Drink plenty of fluids and rest, and monitor the situation. And if things get worse, then seek health care and testing. We want to prioritize testing certainly to patients who have symptoms. We are not testing patients who have no symptoms. A negative test for someone who has no symptoms is really not clinically meaningful. They could be exposed the next day, or they could be in the first day or so of that incubation period, and the test could be negative. So we want to test symptomatic patients and prioritize healthcare providers, seniors, those with chronic medical conditions, and anyone else who's very ill.
And as a follow-up to that, are we seeing a spike in cases because there's better access to testing or because more people are infected?
We are actually seeing a spike in cases because more people are infected. And as we look at all of the case results coming in, the positives and negatives, we can see that. So the number of new cases is increasing at an exponential rate. We are doubling the number of new cases every 2 or more days, and it's not just increased testing.
And then another question on testing from ABC 27. Given that you're telling people to stay home if they have mild symptoms and the lack of test availability at certain sites, are you able to predict how accurate the numbers of positive cases are? Are we tens of cases off or hundreds of cases off?
So we don't exactly know, but we really do strongly feel that there is community spread, particularly in the hardest hit areas. So that includes the Southeast, that includes Allegheny County. And so we will have an underestimate of the number of new cases, which highlights the rate that it is changing even more. That is true, of course, with many illnesses, particularly the flu. And if people have mild symptoms, they don't get tested from the flu. We always say that the numbers, significant as they are an underestimate. And that would be true of an infection like COVID-19 as well. More important than the specific accuracy of the numbers is actually trying to prevent its spread in the community. And so by people with very mild symptoms staying home, we're very much trying to prevent the spread. For instance, if you go to the hospital, the emergency department, then other people in the emergency department could possibly be exposed. So the most important thing is to prevent and mitigate the spread of COVID-19.
We have a question from the Record Herald. Is it safe to eat takeout food prepared by an outside source, such as a restaurant, where we don't know the health of the workers?
Well, we will rely upon the good judgment of hospitals that if someone has active symptoms, that of course they would not be preparing food for you. So I can't take away any risk, but it is certainly if anybody is in the health in the food preparation industry, then if you have any symptoms whatsoever, please stay home so that you don't spread it to someone else.
And from Fox 43, if an essential worker is at higher risk, immunocompromised, and over the age of 65, should they not go to work?
I think that would be a discussion with the individual and with their employer. Outside of the healthcare industry or a life-sustaining business, we've asked those businesses to close and for those people to either telework or to stay at home. If that person is in a healthcare industry, they'll need to talk with their employer about whether they can work from home and telework or whether they need to come in. That'll be a decision with the employer and of the health facility and the individual.
From KYW News Radio, playgrounds in Philadelphia were shut down yesterday at 6 p.m. What advice do you have for families with young children living in small urban homes with limited outdoor space about how to cope? Many rely on public areas for outdoor green space.
It's a real challenging situation, and so again, all of us are challenged by the social distancing that is required to prevent the spread of COVID-19. I think that's particularly true with families with young children. I would try innovative and creative ideas in terms of children, in terms of games, in terms of making games out of washing your hands and things like that, maybe cooking together. And if you can go outside and can maintain social distancing within your yard or your neighborhood, then that would be good. And I think that together, every family and all of us will get through it.
From Wallace McKelvey from the Patriot News, is the administration considering a shelter-in-place order similar to other states and localities? What would that look like, and what would trigger such an order?
Well, we are in those discussions with the administration and the governor, and we will make determinations over the next number of days as the situation requires. A shelter-in-place would be exactly that, and it would be implemented the way other states have implemented it, where we want people and emphasizing even more to stay at home. But those decisions have not been made of yet.
And as a follow-up, will the department be providing demographic, age, gender, etc. breakdown for current or future infections and deaths in the state? What is the current age distribution?
So we can provide broad demographic information. Actually, in terms of the most patients seem to be middle-aged adults, with seniors next and young adults next. So we can give you some broad statistics about demographics, but it's as I've outlined.
Then from Fox 43, what is the protocol for treating COVID-19 for a pregnant woman, and can it be passed on to the baby from an infected mother? So
this is a novel coronavirus, which means that it's never been seen before. And so a lot of that information isn't exactly known. A pregnant woman would be treated the way other people are treated, with supportive care. If she were very ill, with oxygen, with intravenous fluids and bed rest and medicines for fever, etc. And there is no specific antiviral treatment for pregnant women that I am aware of. We know from China is that a number of pregnant women delivered babies and they were fine and had no infection and had no sequelae, no problems after delivery. But the world will be gathering that type of data as the epidemic continues.
From the Pittsburgh Business Times, how many counties in Pennsylvania have no intensive care beds or the kind of care that needs to be given in this pandemic? What are the plans for those counties? Mm-hmm.
I don't have that specific data about counties with no intensive care beds, but we'll be analyzing that. If a patient is in for instance, a rural county where the hospital doesn't have an ICU, if they required ICU care, then they will be transported to a medical center that does have the ability to do ICU care. Of course, all the people involved with transport, the EMS and and the paramedics, et cetera, would all have to have personal protective equipment to avoid exposure, and so then the patient would be transferred. So as the Pennsylvania Department of Health works with PEMA, with hospitals, health systems, with HAP, then we will be determining those patterns of transfer if necessary.
We have several questions about testing ability, and when will mobile drive-through testing without a doctor's recommendation be available? Any details for plans in place to increase testing availability?
Mm-hmm. Well, so we have increased testing availability over the last, now just coming on 3 weeks, significantly. So tests can be obtained and sent to our public health laboratory. Again, we're prioritizing those tests to sensitive populations, to particular healthcare workers, to check on any potential cluster or outbreak of COVID-19. And then under doctor's orders, many hospitals and health systems have testing stations or pods where tests can be done. Of course, tests can be done for critically ill patients in the emergency department. And right now in Philadelphia and in Montgomery County, there is drive-through testing. This is part of the federal program to expand testing. And so collaboration with the county health departments as lead in Philly and Montgomery County, and then the Department of Health, PEMA, and the federal government has that type of drive-through testing. But they are prioritizing testing individuals with symptoms. For those drive-through testings, you don't need a doctor's order. Other areas, you do need a doctor's order, so you'd have to contact your health care provider. We are discussing with other health departments, such as Allegheny, and then have discussions with the federal government where we can do any more of those drive-through testings, and we'll have those discussions.
There's a question from PLS Reporter. Has there specifically been any actions to boost capacity in rural areas, given that these parts have older populations on average and fewer beds in the first place to cope?
Mm-hmm. So we're going to be working to increase bed capacity everywhere. So there are 3 phases to our plans. The first is to use our conventional health system, the hospitals themselves, and hopefully most patients can be treated there. If the system can't handle the demand, we would implement contingency measures that hospitals have those contingency plans, adding more hospital beds, adding some additional facilities. We're looking about maybe less sick patients could be at ambulatory surgical facilities, could even patients, if they don't require acute care, so subacute care as they convalesce, be in hotels or something like that, and then transfer when needed. So our goal will be to is to put together all of those plans, again, with the hospitals, the health systems, the county municipal health departments, and the hospital association, so that we have an integrated network to take care of ill patients with COVID-19.
Pennsylvania Capital Star would like to know, is the Department of Health aware of any post facto tests of old flu swabs for COVID-19?
So I'm not aware of testing old swabs that were used for flu for population-based testing. That might be occurring under the auspices of the federal government to look at sort of population-based statistics, but we're not doing that.
Can you please address the nursing license requirement suspension to assist in the COVID-19 response?
Well, we're working with the Department of State in terms of making sure that we have adequate staffing for individuals. So, for instance, we've waived current CME requirements, and if someone's license was coming up due and because of how busy they are, they can't renew it right now, then we're looking to try to take whatever measures we can with the respective professional boards in the Department of State to keep our workforce active and present.
And then the last question from WJAC. The governor's order enforcement was delayed until Monday because many businesses were trying to get a waiver to stay open. Are we sure this order will be effective if many more businesses stay open, or will bigger measures be needed, like shelter in place?
Well, so I gather that the website where the waivers were to be filled out was very, very slow because of the demand, and so the time where it was going to be enforced was extended. But we expect that most businesses are not necessarily life-sustaining, and they should close. For those businesses that feel they are life-sustaining that weren't included on the initial list, then there's that waiver process. I don't think that that will have a significant public health effect. And so we're taking things, one step at a time in a measured approach, as the governor has outlined, in terms of the schools, in terms of recommending that businesses close, include now the order that non-life-sustaining businesses close, and we'll be taking all measures in this very orderly, measured approach as the governor has outlined. So we'll be considering all options, including shelter in place, but that's not in place at this time.
Thank you, Dr. Levine. That's it for our questions for today. We will have another briefing tomorrow. Time will be announced at 10 a.m.
Thank you very much.